From a therapist perspective, I'm sort of always interested really in what the experience is like as a therapist to potentially be immersed in some quite traumatic narratives, really, day after day. And I just, I wonder what your thoughts were on that. Not, I guess, just in terms of how therapists can or do deal with that for themselves, but I was also sort of interested in that in terms of whether you think there ought to be a limit in terms of how long someone works in that particular way, or is it possible to basically get enough support through supervision and so on and so forth to be able to carry on with that? I mean, what are your, having been in that position yourself for a number of years, I'm just interested to know what your thoughts and insights are on that, really.
Yeah, I mean, there's no question that my early exposure to trauma histories was traumatizing in itself, and I think at that point the idea of vicarious trauma wasn't well understood, and I didn't understand that was what was happening. But I experienced some of those kind of symptoms of vicarious trauma: the hyperarousal, the worry, all those kind of things, worrying about people who were close to me, and that can happen in therapists, for therapists working in that field. But I think once I'd understood what was happening and used supervision well and had a good supervisor who could help me negotiate that, it became absolutely manageable. And I think one of the things that I now make sure of in training that I do on this topic is that I kind of front load the discussions about vicarious trauma and make sure that the couple of days starts with information about how to look after yourself, so that people, I hope people come and do the course and think, yep, I can do this. This is something I can do. But what I don't want is for people to then pay the price of doing that, of becoming traumatized in themselves. So do think about looking after yourself, what systems you need around you, what are the kind of pragmatic ways that you can ensure that it doesn't impact on you to a degree that it's sort of impairing you, really. Now, in terms of length of time you ought to do this, that's a really interesting question. I know on my caseload, I try to make sure these days that only no more than a quarter of my caseload is working in this kind of complex trauma field where you're getting really up close to trauma histories. But I think different therapists would have a different take on that. I know some people who that's literally all they do. The whole of their caseload is sort of trauma work, and plenty of therapists who don't see any or just very occasionally. And I think it very much depends on you and your supervision and how well trained you are in doing this kind of work. That would be my kind of take on that.